So the last but not least, let's welcome Dr. Yang Yu. She is a medical microbiologist at Eastern Health, the Newfoundland and Labrador Public Health Microbiology Laboratory. And she also is a clinical assistant professor at Laboratory Medicine, Faculty of Medicine in Memorial University. So she will introduce the laboratory diagnosis of the COVID-19. 那么接下来呢，我们要重磅邀请的就是来自我们纽芬兰纪念大学的于教授，他呢是一位医学微生物专家，所以他接下来要跟我们分享的就是有关于实验室诊断的相关情况。有请我们的于教授。Now we're moving on to our Q&A session. I have seen there are a lot of questions raised by our passionate, enthusiastic audience, which is good. And now we will invite all the guest speakers, please, to open your microphone and waiting for our questions. And here in this session, we will, Eric and I will co-host it. So Eric, how about you start first?
Okay, sure. So my first question here is for Councillor Carroll. And it says right here, how does the city inform and engage community on status of COVID to ensure access to testing?
Charlie?
I'm not sure,
Councillor
Carroll?
Yeah, now I can hear. Go ahead.
That's good,
Yeah.
okay.
Yeah, it's a multi-pronged approach. Can you hear me?
Yeah.
Yes.
Okay. Yeah, it's a multi-pronged approach. It's important to note that that the criteria that you just saw is really brand new. We've been frustrated by, it sometimes feels as if the testing was much more accessible than it was. And many people thought that the problem was a shortage of nasal swabs, but you've just had the presentation that explained to you that the real shortage is the time and laboratory capacity because it's such a complex test. So the new criteria that now exists, the approach that's being taken is to get the information, first of all, make sure that the testing centers have it. And each of the testing centers, different hospitals in the city of Toronto, for instance, are specializing in different types of patients. One hospital may be the place where most of the shelters on the east side of town are sending shelter residents. Others may be where family medicine and family practices are being encouraged to direct people. North York General, for instance, in our area is mostly coming from family medicine cooperatives. And so making sure that the new criteria is with them was the first step, so that healthcare professionals know who to direct. It's really still an active conversation as to how we might go about going out into employee groups and saying we're going to figure out ways to test you. What the municipal public officers of health are doing, Dr. Eileen Davila and others like her, Dr. Lowe and Peel, are watching is how is the hospital sector handling it? They are already right now having to deal with what happens when you take testing out of the hospital, send a crew to a long-term care home. So they're watching well that's whether or not the laboratory is able to take care of that, because part of opening up may mean testing employee groups in other fields, but let's watch how the laboratories are able to deal with the capacity issues that will be there when we're doing aggressive testing in the congregate settings like long-term care and shelter populations. A couple of hospitals just recently redeployed crews that included nurses, a doctor, and a couple of RPNs that can do the admin and paperwork of going into long-term care homes that have a lot of beds and may only have had 10 positives and 1 death. Can we stop them from having 25 deaths? So a whole crew in that setting really amps up the amount of work the laboratory capacity has to confront. We'll know in a week or two whether or not we can then go from there on to the other types of populations that Fang Li just described in the new criteria. That's why I asked the question about essential workers, because, for instance, transit workers are really anxious to be prioritized for testing before they reopen, so that they could prioritize onto the busy routes those who may show that they have antibodies or have already been through this. Then could we put them on the busy routes where distancing is going to become very difficult when we reopen? We're looking at those types of things.
Yeah, that's a great point. Thank you for sharing.
Thank you, Sherry. And our next question is for Dr. Bai. Dr. Bai, are you still there?
Yeah, I'm here.
Okay, so it's a very interesting question. It said we have hold a press conference in China that they recommend to use Chinese traditional medicine. They said about 20% of the Chinese patients are recovered because of that. So how do you think about this? And will Canada or Canadian doctor will adopt or kind of use the Chinese traditional medicine in the treatment here?
I just want to say that it would be nice to see the evidence first before recommending the Chinese traditional medicine. I find I'm more open-minded. Whatever works, if it's proven to work, I'm happy to apply it.
Yeah, thank you. 那么我们关于这个中医的问题呢，我觉得我们的白医生也给我们解答了。我们首先还是要尊重科学，如果我们有了很 concrete 的这些 evidence， 我们是可以考虑，是吧？好的，Eric.
Right here, I have a question for Dr. Yu, and it says, how much does the RT-PCR cost for testing one person?
Just brief to say that there's no charge for individuals, but the test itself depends on different kit to be used. So some labs have a laboratory developed a test that means they can use some reagents and then their own primers or probes. Actually, that's around $20, and depends also on the volume, right? And in Canada right now, the expense for testing is not a big issue. So the reason why there is a limit of testing capacity is all related from the swabs. So swabs, we have been using Italian company produced swabs, and because of the demand and also because of the situation in Italy, the whole chain of the supply basically broken. So that's why the swab is a big issue. And then the laboratory actually has been really creative to validate different alternative swabs to deal with it. So that's why, like when I show you that ER doctor's swab actually is different alternative swabs has been used. So the reagents, same thing. So we are using a couple of big companies' reagents, and then with global needs and with transport as issue, everything as make it so challenging to have a test. Like for myself, I have been keep validating different alternative assays to be prepared. So like everyone in the lab has been working hard to get Canadian the best opportunity to test.
Thank you so much. 下面这个问题可能要请教我们的这个谢女士。我们看到我们的群友里边，就是我们的这个观众群里边，不仅仅有我们 Torontonian， 不仅仅有我们 Ontario， 还有一个网友 from BC。那么他也关心的就是，他知道这个 BC 省的 Dr. Henry 每天都是定时更新这个 update 的，不知道我们这个安省的卫生官员是不是也是这样做的？
安省的卫生官员哈是 initially they provided daily update, but I'm not aware now they're doing daily updates. So, but you can still check the case status from the Ontario.ca COVID-19 website. You can also most update information from your local public health website. But I'm not aware of the daily update, the news update from Ontario public health officials. Yeah. And also I want to address the question about essential workers. I think I shall asked the question.
Yeah.
So for essential workers, this categories was added to the April 15 guidance document. So I provide the website. The transportation workers is included under that new guidance document. But I don't see many people currently tested from that essential worker categories. I think we'll pick up slowly over time. Yeah.
Okay. Eric, do you have any other questions?
I have another question for Shelley. It says right here, so how do we prepare for the reopening of Toronto? You mentioned that when this pandemic subsides, when it comes to much lower numbers, that the reopening of Toronto is going to be a lot more different. It's going to be a lot more critical on its safety. So can you give me some? Could you give us some ideas on how or details on how this will be like, and how to prepare for its reopening?
Well, one of the things that's being looked at now, we know for sure that people will be more confident about a re-entry into public life if they know that masks, that for certain activities you could require them of anyone who knows that they may have been exposed. There'll be places where you want people to wear them. If you're coming into an ER because you have any kind of respiratory symptoms, it's natural to assume that between now and a year from now when we have the vaccine, if we touch wood, if we have the vaccine, that you might want people to wear masks in all sorts of places. So they're already working on what can we require based on supply in Canada that would give people comfort. You might want to, today you may have seen on the news that a private sector grocery store owned by Loblaws experimented with announcing today that they're going to advertise that all of their employees have their temperature taken every day by a non-contact laser thermometer, and that customers have the option of having their temperature taken as they go in. If that doesn't explode in an uproar, that's an invasion of my privacy, and it didn't. People actually received that idea very well. It's logical to assume that they're going to start to ask policymakers to make that policy. Why don't we require that, at least for the next 6 months? What are the supply issues of all of those types of policy decisions? So all those things are being looked at right now. What's also being looked at, though, are the things like programs that we ran before. What can we start back up? If we can't, for instance, have summer camp, what does that mean for children's services? If we're going to go through a whole summer where we're saying you can now return to work, we need to kickstart our economy, but we don't want kids in group settings until September, we've got to deal with those issues as well. If we don't want to have special events, things like that, what are the mental health ramifications? Employment has to begin, and we need to start to robustly look at our people who've lost jobs able to become a part of a COVID effort that will continue on in social development and social services for some time. And how do we find that? And how do we do the recruitment safely? Those are all the active conversations that are going on right now. So there's the medical supply side and the public comfort with the safety regulation side, and both are being looked at. But it's, as you heard described in terms of a lot of it is like the testing dilemmas. Most of it is supply chain. We know what we'd like to implement. People have said from the beginning, can you require everyone to wear a mask? We can't if you can't buy a mask for love nor money anywhere in town. We know, though, that we're soon going to get to the point producers are working as fast as they can. We will soon be just the same way things are cash register. Until we don't have that kind of supply in the general market, we can hardly say to people, we'd like you to wear a mask on the TTC. So they're trying to get enough intel to know what they can require and what they can implement about a month from now. Yeah.
Thank you for that.
Thank you so much. And the next question will be for the Miss Xie. 有一位这个观众朋友问呢，就是如果他是一个轻症患者，轻症的阳性患者，什么是一个对他来讲最好的这个策略？比如说他现在真的检查出来阳性，但是可能还没有特别明显的症状，因为我们加拿大没有方舱医院嘛，现在，所以只有10%的人能住院。那么他们自己在家自愈，这种是最好的方式吗？我们怎么才能帮助这些人更好的治疗？
就是目前为止呢，那个轻症的病人是送回家治疗的，就是自愈的啊，因为这个病毒本身没有那个治疗的方法，就像那个医生提到的，所以呢，即使你想住院，医院也不会让你住，医院会把你送回家，所以大概就是说，大概10%的人他有满足这个住院条件，他才能够去住院。我觉得这个理由呢，是因为怕医院 get overburdened， 所以医院他会。所有的人如果都涌向医院的话，医院就是这个系统会受不了，所以它是基于这个 rationale。因为我们现在公共卫生看到的，像我们区住院率只有8%的人住院，其他部分都是就是回家送回家。然后呢，公共卫生的护士他会每天打电话监测，询问你的症状，如果有加重的情况下呢，他会安排你住院的。所以这个有很多时候是不是你能选择的，是根据你的病情，就说你即使想住院，他也不会说你可以住院。我不知道会不会
做一个尽快的补充。实际我觉得适合于加拿大的国情。中国的建方舱医院，特别是大城市里边，因为它是都住 apartment， 在家里隔离呢，会影响家人很大。加拿大总体来讲都是环境比较好，空间比较大，所以呢有这种条件。可以在家里做。另外呢，加拿大从资源来方面、管理方面不如中国那边这个更严格一些，所以呢，在家里是最实际也是可行的一种办法。
好的，谢谢王教授的补充。那么这里边可能这个问题还得接着请教您。有一位网友问呢，这个英国的论文给我们的 COVID-19 分了 A、B、C 3 types， 那么加拿大确诊的时候是否有分型，哪一种更严重，就是说更高的几率得这个重症啊？是不是要等到多届这个疫苗的出来，单届的好不好？
现在来讲还没有这个分型，现在 A、B、C 型，它根据这个遗传特征，就是因为它遗传主型，然后我们说野生型最初从哪来的，然后它分型。这个来讲呢，现在检测当中没有包括这个，可能杨医生更知道一些，更比我了解一些。现在只是限于科研这个阶段，前面那个报的这个 sample size 以前报的也并不是很大。所以现在流行这么多人，现在的分型如何，我并不是特别清楚。至于这个分型是不是跟这个疾病的 prognosis， 它的这个预后有相关系，我这点没有任何的这个资料，我没看到任何资料。可能呢，到通尼白呢，可能也许有相关的信息，我相信呢应该没有相关的 research， 如果有更好。
So Dr. Bai, do you have any kind of thing to more add about the types of the COVID-19, A, B, C?
No,
do you have read any research?
So 我也不知道，因为我们在做 testing 的时候，我们不知道是 A 或者 B 或者 C， 我只知道它是 COVID-19 或者 not COVID-19。
OK， 那我们可能还是需要这个研究，还是要继续的。我相信这个 COVID-19 对于我们现在所有医疗界的，不管是研究人员还是临床人员，都是很新的问题。我们的研究还在持续的进行过程当中，所以大家也可以继续保持我们这个关注。OK， Eric， do you have any more questions?
Mm, I have one for Dr. Yu if we have time. Yeah, we do have time.
Yeah.
I have a question. The current status of the Spartan testing cube manufactured by the Canadian company, the Spartan testing cube.
All right. Yeah. So I think people might be interested is in the news. So just a quick words about the ABC. So that's basically like only in research when you do whole genome sequence of the virus, then you will know. The current one only testing the segment, so you won't know exactly. Then go back to the question of Spartan, and also people ask about 5 minutes testing in the States. Like, are we going to have something like that? Yes. So Spartan is a similar idea. So that's the idea of molecular testing gave a rapid result, because if you look at the laboratory nucleic acid testing right now, from the specimen arrive in the lab, you need to get the RNA out, extraction, and then you do the testing. The time needs would be around 4 hours or even more. And Spartan is a quick test. We don't know how the performance yet. So right now in the couple of hospital sites are doing the evaluation. So far, there's still some questions about its performance. So first of all, the sampling might be a question. So use a different type of like a little plastic spatula that's actually more for the genetic testing. So that's the whole device actually invented at the very beginning. So used now for COVID-19. So secondly, whether this means truly positive or false positive or miss some, we need to have parallel laboratory is still quite premature to say that, but that's a good idea. And that will be something hopefully States. And then go back to that question about 5 minutes in the States. There is this molecular testing, but unfortunately the company won't be able to have any available to the Canadian community yet.
Right.
Yeah.
Okay.
Thank
So
you.
next question will be for Shelley. It is also regarding to the Chinese traditional medicine, because in China, the CDC in China have in their official website said there are over 70,000 cases, successful cases with the treatment by the traditional Chinese medicine. So in Canada, do we have to offer what kind of supportive material or what kind of supportive evidence to promote the Chinese medicine here adopted in Canada case, especially from the perspective of government?
Well, it's really important for people to understand, and this will be a comfort to everyone on the panel here, especially Dr. Bai. When it comes to policy making, that is where I can honestly say that once you're in a crisis mode like this, there's far less partisanship. So while it would be nice to say, I'm going to grab a brand new base of voting by endorsing this, and being the first person to say we're going to adopt guidelines to say that we endorse licensing or whatever around this, we're going to err on the side of science on this. If there isn't enough evidence yet in the medical profession to say this is a solution, then you're not going to hear it from government and policymakers. When we're facing a death count every day, we're not going to stick our necks out because it would make political points. We're going to go with the evidence. And you've already heard Dr. Bai, Tony, if you don't mind my saying, say, I need to see the proof. The same reason that he needs to see proof from the data that we're looking at in Western science, we would need to see it in the same sort of control group settings to have confidence in those types of medicines. And it just isn't there yet. And so, people might take comfort from it, but we can't endorse it as a solution and say, if you haven't already adopted this, you must. We can't politically wade into that territory. We have to follow the science. And I can honestly say, there are people in leadership positions right now who I always agree with, or sometimes agree with, and never agree with. We have leaders in all of those categories. All of them, I've seen evidence that they are relying every day. Doug Ford is relying on Dr. Williams and Barbara Yaffe. Justin Trudeau is following Dr. Tam's lead. Dr. Davila is everything in City Hall right now. And that's what you want your policymakers and politicians doing at a time like this. It's part of the reason that you see the struggles around how to go back to meeting as governments, because when you're in a state of emergency, you give the leader all the power, and he keeps in touch with us. So he's not going to abuse the power that he has, nor would Doug. Doug's still meeting with this cabinet. So is Justin. But when we go to have our council meeting and they open their House of Commons, you saw them debate that all day today federally, you lose a little bit of control of that doing what the doctor says. And so we will probably open our government up to begin to debate things at the end of April, and the federal government will do so around the same time. But you'll see us putting really strict limits on what we debate, so that for as long as we can in the COVID crisis, the doctor has more power than the politicians.
Good to hear that, and we really respect that our government, our medical regulators could consider the balance between the ensuring the safety and effectiveness of the medical device or medical solutions. So just for the best for most of us. So thank you so much, Shelley.
Yes.
And for the ECMO, I think Dr. Bai have already answered. Okay. So do we have any more questions? We only have limited
I think we're coming up on 10:30. Yeah.
Okay,
Yeah.
I will leave the last question for you.
Can I ask one question?
Yeah.
Okay. Yeah. I want to thank everyone, especially the guests and our counselor. Ask a counselor one question. So I know you're from Toronto area, so I see a lot of people living in other regions like York region or Peel region. So when they come down to the corporation, are all the counselors or even mayors, they talk about how they cooperate? For example, then reopening for business, how that goes. Counselor?
Yes. Yeah. In terms of opening things up for business, there is some evaluation going on right now about if we have to get businesses and employees of businesses, most importantly, if we have to get them through the entire month of May, what does that look like? Because most of the reliefs and supports were really about getting people through April, and now we know we're headed towards May 1st, which is not just rent for people, but commercial rents, which no one has really offered relief from. And so there is some concern there. So we would like to open up as soon as possible, but we know that given that we're just now getting to the peak and the flat part of the curve, that you really want a couple of incubation periods afterwards. So we know we have to make do probably for most of the month of May. And that being the case, we are already setting up roundtables with businesses to talk about in the various sectors that are most prominent in Toronto's economy and really the GTHA economy. We're gathering roundtables to talk about what are the challenges for you if you're open for business. Things that we've already heard are the businesses with a lot of public interface. How do they get open? The biggest concern is how do we get back to where people can go to restaurants and there's a feeling of confidence. We've always had a great deal of confidence in Toronto's restaurant inspection system, and replicated throughout the GTHA and the rest of Ontario over the last few years. But how do we get back to what if there is anything that we need to require there, or if there are limitations on the number of people in a place? We're going to have roundtables. They actually started last week and will continue on for the next couple of weeks, so that we can gather as much information as possible and then begin to develop guidelines. But for most businesses, they will be voluntary guidelines, because we have to be honest. We won't have the capacity as we open back up. We're a government right now because we don't have income tax. So while there's consumerism still going on, we're losing $65 million a week as a government in the city. So we won't have a lot of extra resources. Yeah, it's a big number. Between transit and other types of inputs into the city that aren't coming, it's $65 million a week.
Wow.
And so we'll be $1.5 billion out if we go to the end of the month of May. So a lot of what we're going to recommend to businesses as we say go ahead and open up, whether it's be it June or whenever, will be these are guidelines, and they're largely going to be voluntary. And what we will have on hand for people is advice and bylaw officials that can help you set up a safe environment, and there will be incentives to do that safe COVID preventative environment, because we got to be honest, we're not going to be able to continue on the level of enforcement that we're right now doing, where because people are staying at home, our police are doing nothing but COVID misbehavior prevention, and bylaw officers are racing around checking to make sure businesses aren't open because of COVID. If we open back up, they will have all their other responsibilities come back. So what we'll probably end up having is a long list of voluntary guidelines that meet each sector, and we'll also be relying on the other orders of government to decide what happens to travel for the businesses that are all about, whether they're about tourism or hospitality, or if they're businesses that just rely on a certain amount of global travel to get their business done. We'll need a lot of guidelines that will come from the federal business way to kickstart the economy again.
So thank you. Yeah, really good answer. Yeah, thank you.
Thank you so much. Thank you so much for all our 5 guest speakers. Great sharing, and especially for the Councillor Carol. And thank you so much for explaining the policy to us, to understand the government, how the government work, and how we could coordinate with the government to let everyone on the same page. I think it is not only the government's responsibility to protect us, it is all of us' responsibility to protect us. So thank you so much, and all the professional expertise to share a very informative thing for us to clear up a lot of the misunderstanding, misinformations, misinterpretation. So I think this is really, really great event. And my special thanks to all the audience. And I have seen a lot of great questions has raised, has inspired each of us. And because we don't have a lot of time, due to the limited time, but we will collect all the questions that are unanswered, and we will send to the professions, ask them. Hopefully they will answer them, and we will organize. And I think Professor Wang will updated their website or their WeChat account so people can follow. So is that possible, Professor Wang? You can share the slides.
They should
so
do.
your WeChat account and the website.
That's good. Yeah, we are going to do that, and I'm very glad to see so much enthusiastic response from the group, and particularly from the audience. Yeah, this is very successful, and I think we should do this again before long. Yeah, good.
Okay. Yeah, we should learn every day. It is very new thing.
Okay. So Maggie, I just want to take this chance to thank Councillor Shirley again, Dr. Bai,
Sure.
Dr. Yu, Ms. Xie, and definitely Professor Wang. Also, all the volunteers, include yourself and Eric as a host. And the last, I want to say again, take this opportunity, let's fight together against COVID. Also, I want to ask everybody, we can work together to help the community, to support the community. Also, for the very, the concrete step, if it's possible, you can donate through this, Canadian Red Cross. CCEA work together with Red Cross. Now you can donate, you can get your tax receipt. I think at the end of it, before the end of this month, if you donate $100, actually another company are going to give you $200 to match. So in total, you actually donate $300 to the Canadian Red Cross. And the Red Cross, I think they commit for this kind of money, they're going to put into the COVID-19, the disease fighting. So that will be very good opportunity for everyone to contribute. Definitely protect yourself well, protect your family well. Then we all together, and I think we can win this battle. Thank you very much.
Okay, thank you all.
You bet.
Thank you.
Yeah,